No more Helicobacter pylori. Helicobacter pylori H. pylori was first isolated by scientists from the gastric mucosa of patients with gastritis in 1983. It is a unipolar, multi-flagellated bacterium with a blunt end and a spiral curve, about 2.5 microns in length, approximately 4 microns, about 0.5 microns to 1 micron wide. Helicobacter pylori infection is the most common cause of gastritis and peptic ulcer disease worldwide. Infections are very common and increase with age. About 50% of people 60 and older in the United States are infected. However, recent studies have shown that the number of young people infected with Helicobacter pylori is decreasing. Infections are most common in blacks, Hispanics and Asians. Helicobacter pylori infects the gastric mucosa and can also be found in stool, saliva, and dental plaque. Helicobacter pylori can be spread from person to person, especially if an infected person does not wash their hands thoroughly after using the toilet. Because people can also spread germs through kissing or other close contact, infections tend to break out in homes and among people living in nursing homes and other supervised care facilities. Helicobacter pylori grows within the protective mucosal layer of the stomach wall, where they are rarely exposed to the stomach's highly acidic environment. In addition, H. pylori produces ammonia, which helps protect the bacteria from stomach acid and allows it to break down and penetrate the mucus layer. It mainly lives in the gastric mucosa and is the only known pathogenic microorganism in the stomach. Helicobacter pylori infection will 100% cause active gastritis, but 70% of patients will not have any symptoms. Unless they undergo a gastroscopy, these patients will not be found to be infected. 10% of people will undergo gastroscopy due to symptoms of indigestion, and are ultimately diagnosed with active gastritis or peptic ulcer. 80% of peptic ulcers are caused by Helicobacter pylori, and among patients with Helicobacter pylori, 15% to 20% will develop peptic ulcers. Helicobacter pylori grows within the protective mucosal layer of the stomach wall, where they are rarely exposed to the stomach's highly acidic environment. In addition, H. pylori produces ammonia, which helps protect the bacteria from stomach acid and allows it to break down and penetrate the mucus layer. Nearly all people with Helicobacter pylori infection have gastritis, which can affect the whole stomach or just the lower part of the stomach antrum. Helicobacter pylori can increase gastric acid production, interfere with the normal anti-acid mechanism of the stomach and produce toxins. Sometimes the infection can cause erosive gastritis and even gastric ulcers. Prolonged infection with Helicobacter pylori increases the risk of gastric cancer. What are the typical symptoms of Helicobacter pylori? 1. Bad breath. Helicobacter pylori is one of the most direct pathogens causing bad breath. After Helicobacter pylori infects the human body, it parasitizes in the stomach and reproduces in large numbers. Helicobacter pylori can decompose urea to produce ammonia, hydrogen sulfide and methylmercaptan. These gases are the main components of bad breath gas. 2. Gastrointestinal symptoms. Patients with gastritis and peptic ulcer will have corresponding symptoms, such as gastric ulcer pain and abdominal pain. These symptoms usually appear 1 hour after a meal and can be relieved after 1 to 2 hours. Combined with duodenal ulcer, patients may experience abdominal pain at night and may also experience pain on an empty stomach. 3. Skin problems. There is clinical evidence that Helicobacter pylori infection is also related to severe acne, rosacea, and eczema. After Helicobacter pylori disappears, acne may be relieved. Doctors make the diagnosis based on the results of a breath test or stool test, or a gastroscopy upper endoscopy using a flexible viewing catheter. Treatment is with antibiotics and a proton pump inhibitor.